When you get a new pup, the last thing you want to be thinking of is them coming down with one illness or the other. This is why it is part of your responsibility to be able to identify and curtail these conditions when they eventually surface. Here are 8 common health issues that affect dogs. Number 1. Arthritis. Canine arthritis is a particularly painful condition that results from inflammation of the joints, the most common type being osteoarthritis, and often attacks senior dogs. This condition is often accompanied by a great deal of pain and stiffness, impacting a dog's flexibility and motion. So if you ever notice your dog limping all of a sudden, experiencing episodes of stiffness, particularly after periods of sitting or lying down, or they yelp in pain when they try to move or get touched in affected areas, there's a high chance you're dealing with arthritis. Arthritis is a degenerative disease, and if left unmanaged, will progressively worsen over time. So if these symptoms sound familiar, you should schedule an appointment with your vet to get the situation under control. Number 2. Ear infection. You might think you're doing your canine buddy a lot of favors by cleaning their ears every now and then, but just like humans, earwax in dogs forms a protective barrier against various forms of invading bacteria. Ear infections in canines may also be due to allergies, autoimmune disorders, or even wax buildup in the ear. The infection can be very itchy and uncomfortable for your dog, making them super sensitive as they constantly scratch and shake their heads aggressively. Other symptoms may also include a foul odor emanating from their ears, dark discharges, and redness or swelling in the ear canal. Certain breeds like Cocker Spaniels and various retrievers are also prone to ear infections because of the anatomic shape of the ear canals and the buildup of moisture, wax, and discharge. So owning one of these signifies a need to be more proactive and observant with conditions like this in view. It's advisable to take your pet to a vet as soon as you notice a concurrent appearance of these symptoms. After a vet's diagnosis, dog ear infections are usually treated with a medicated cleanser, topical medication, or possibly oral antibiotics and anti-inflammatory drugs. Number 3. Obesity. According to recent statistics, it is estimated about 56% of dogs are either overweight or obese, making obesity the most common preventable disease in dogs. As much as this is a growing problem among these canines, there are recommended measures to keep them in check. They include keeping your dog on a healthy, low-carb diet along with regular exercise program. Another thing to note is obesity is not a standalone, as it increases the dog's risk of certain types of cancer, arthritis, diabetes, heart disease, and hypertension. With all these in mind, you should know well to resist the urge to overfeed them, even when they seem to crave any food item you have in your hands, especially if you've gradually accustomed continually feeding them to keep them happy. So if you notice your pet developing a rounder and puffier appearance, or they sleep more hours than usual, it's time to slash that diet and take exercise routines more seriously. It's also best to consult your veterinarian before changing your exercise or diet plan, just to ensure they don't fall below their nutritional requirement as much as they're watching their weight. Number 4. Dental disease. Dental disease in dogs may vary, but it usually occurs as a result of poor oral hygiene. Periodontal disease, also known as gum disease, is the most common form that affects the gum and tooth for dogs. If not well managed, a dog's teeth might become rotted with bacteria to the extent that they may require a surgical procedure to remove the infected teeth, preventing the infection from spreading to the jaw and skull. Several signs indicate that your pet may have dental disease. These include difficulty eating, bleeding of the gums or teeth, loose teeth, and bad breath. In worse cases, the bacteria can enter the bloodstream, potentially leading to damage to the heart and kidneys. The key to protecting your dog is prevention. This includes brushing your dog's teeth several times a week with a xylitol-free toothpaste and a recommended periodic ultrasonic scaling, and cleaning at the dentist to maintain optimal dental health. Number 5. Urinary tract infections. Simply known as a UTI, this condition can greatly interfere with how frequent and how comfortable it is for a dog to pass urine. Urinary issues are common in dogs. Potty training can be a handful, but having a dog who's properly house trained still pee in the house can be frustrating. At first, some owners might think their dogs are regressing on their house training, or may just rule it down as a behavioral issue. but in a lot of cases, it might actually be as a result of a urinary tract infection, especially if it is a puppy or has other underlying medical conditions. Signs of urinary tract infection include drinking water more than usual and passing urine more often than usual. Your dog may also only pass a small amount or lose bladder control. Additionally, you may see blood in their urine or notice a strong smell to it. If your dog shows any of these symptoms, it's important to consult a veterinarian immediately, as they could also be signs of a more serious issue, like bladder stones or urinary blockage. Number 6. Vomiting. Dogs may have concurrent vomiting episodes for countless amounts of reasons. Vomiting is a common health issue in dogs, influenced by a list of factors, including dietary indiscretion, infections, parasites, and certain medical conditions. While occasional vomiting is usually not a cause for concern, frequent or persistent vomiting can be a sign of a more serious underlying health issue. Some dogs may vomit due to eating too quickly or consuming something that doesn't agree with them, such as spoiled food or a foreign object. In these cases, the vomiting typically resolves on its own within a day or two. However, if vomiting persists or is accompanied by other symptoms such as diarrhea, lethargy, or loss of appetite, it may be indicative of a more serious health issue. In some cases, vomiting can be a sign of an underlying medical condition such as kidney disease, liver disease, or pancreatitis. These conditions require prompt veterinary attention and may require ongoing management. Number 7. Parasites. Parasites can be a significant health issue for dogs, causing a range of symptoms and potentially leading to serious illness, or worst case, death. There are several different types of parasites that can affect dogs, including fleas, ticks, mites, and worms. Fleas and ticks are external parasites that feed on a dog's blood. They can cause itching, irritation, and inflammation, and can also transmit diseases such as Lyme disease and Rocky Mountain spotted fever. Regular flea and tick prevention is essential for keeping dogs healthy and comfortable. Mites are another type of external parasite that can cause skin irritation and hair loss. These conditions can be effectively managed with medications, but can be quite uncomfortable for dogs if left untreated. Internal parasites such as worms can also be a health issue for dogs. Common types of worms that affect dogs include roundworms, hookworms, and tapeworms. These parasites can cause diarrhea, vomiting, weight loss, and other symptoms. Regular deworming is important for preventing serious health complications from these parasites. Number 8. Skin issues. Dogs can experience a wide variety of skin issues with a lot of causative agents. Itching and scratching are typical signs of skin issues in dogs. Their skin may suddenly appear red, inflamed, flaky, or scaly, and in some cases, they may lose patches of hair. Yeast infections in dogs are less severe than bacterial ones, but nonetheless, any observation that appears abnormal or seems uncomfortable to them is a clear pointer that they may need to see a vet. A dog can develop skin problems due to a variety of reasons, including allergies, parasites, bacteria, or yeast infections, etc.